pediatrics and okay, great. We are in the Convention Center, Washington D.C. downtown, as part of the American Academy of Pediatrics annual meeting and expo 2014. I am Dr. Thompson NTUBA, the editor of Health and Development magazine, and with me is
Dr. Jennifer Foltz.
Dr. Jennifer. You are a member of the Uniform Services, and apparently, I suppose you are an MD, right?
That is correct.
Tell me a little bit about your background.
So I'm a pediatrician. I did an academic fellowship and then came into the public health service through the Centers for Disease Control and Prevention, and wanted to work on systems level health, and then with the public health service respond to needs for more medical care around the world.
You have been part of this meeting, and apparently you've looked at the schedule. I was wanting to find little differences between your practice and everyday civilian practice. So, what is it about your practice that is unique vis-a-vis children who come through the borders? Some may be illegal and they have health problems at that point. How do you help them?
So people that come to see me, I see them when I am on call. So I take call through a rapid deployment force team, and we see children that are in need of help that are outside the capabilities of the local health systems. So, for example, we responded to the unaccompanied children that came across the border, and there was a need for increased health care, so we helped to provide that.
When you see those pediatrics age, what is the predominant problems that they present when you see them?
And so our situation is a little different than a primary care pediatric practice in that we see them in emergent situations. So it can be anything from needing health vaccinations as they're coming across the border to doing physical exams to make sure they're healthy to transport to their next destination. And then on a daily basis, taking care of systems level improvements. So there's quality improvement practices that we help support physicians behind the scenes.
You know that the military is moving from a system of healthcare to a health system. How are you prepared? What have been your input in that transition?
So we're working on health systems at the Centers for Disease Control and Prevention by working to link systems. So I can give you an example for child obesity research demonstration projects where we've supported linking healthcare to schools, to daycares, to after-school programs, and to the home with the parents as the center. So how can we link all those systems to make it more supportive for healthy choices for children?
We noticed that there is something that has to do with military families, and in this situation, veterans. Apparently, the previous VA secretary resigned because of some problems which had to do with delay in care of veterans. Do you think that that has been addressed somehow vis-a-vis your presence in the force?
My work is within public health response, and so I personally haven't been involved in that piece, but I do think it is an important piece, and here it's being worked on.
Public health has to do with the health of communities, the health of populations, and apparently I would think that you are involved with public health as it relates to the pediatric age group. What are some of the major concerns vis-a-vis vaccination, especially as there are some people in the US and other countries who say that vaccination is not good for their children?
So I work on childhood obesity and working on preventing chronic diseases. So the pieces that we work on are helping to support the right type of guidelines, the right types of interventions so that pediatricians can deploy those in their practices.
childhood obesity is a major problem. Do you think that the rates of insulin dependent diabetes is higher because we have a higher rate of child obesity in the United States?
So there are types of diabetes that are connected to higher rates of obesity here in the United States, and we've been seeing those increase over time with the
Uh,
increases in obesity.
have you found that among children?
Yes.
Um, what is it about this conference that has been particularly very useful to you?
So I've found there's a new section on obesity, and they are putting together different resource packages and working towards supporting physicians. So it's been very helpful for me to be a part of that and attend that and have sharing of resources so that we aren't all reinventing the wheel, that we can build on the successes of other people's work and share seamlessly so that we can all benefit from it and the children here in the nation that we're serving.
So, what in your life were there experiences? Why did you join the uniform corps?
I I find it most satisfying to serve others.